Welcome to our presentation today, Stay Safe, Stay Cool, Adults 65 Plus in Extreme Heat. Thank you for joining us. So this is a collaboration between the Boulder County Area Agency on Aging and Boulder County Public Health. And I will drop some information in the chat, but we hope that folks can continue to join us through our Age Well series and Caregiver Education series. You can find out more at boco.org/agewell series. And again, I'll drop that information and more into the chat, and I'm going to hand it off to our public health friends for now.
Great. Thanks so much, Lindsay. For those of you who don't know me, my name is Grace Hood. I'm Climate Action Team Lead at Boulder County Public Health. And I'm here with Stephanie Pease. She's a master's in public health practicum student who's working with Boulder County Public Health. And Stephanie is getting her master's degree at the University of Colorado Anschutz. So as Lindsay mentioned, we're here today to talk to you about extreme heat. We're going to be talking about why adults over the age of 65 are among the highest risk groups in Boulder County. And we're also going to be telling you about Boulder County's first extreme heat emergency response plan. So let's get started and head to the next slide here. Okay, so extreme heat is sometimes referred to as the silent killer. And this simple weather disaster kind of trips people up. It causes a lot of hospital visits. And really, these are, unfortunately, preventable deaths in a lot of instances. Let's head to the next slide. So just to zoom in a little bit more, here's some information related to a recent extreme heat event, and it was the heat dome in the Pacific Northwest. And in Oregon, there's some interesting numbers that I wanted to share with you all. 72 deaths were attributed to heat in June when everything happened. Officials believe that number to be much larger. The mean age of deaths in Multnomah County, which surrounds Portland, was 70 years old. 90% of those who died were white. 2/3 of deaths were male. 20% of folks who died lived in mobile homes or cars. And lack of air conditioning was the key driver in mortality. Among those who died, no one had central air conditioning. Let's head to the next slide. So as we know, it's getting hotter in Boulder County. We can feel that just in our summers and our summer temperatures. And climate projections show up to an 8-degree Fahrenheit increase in summer temperatures. And really what this could translate into is really down the road in 2080, we could see as many as 30 days over 100 degrees Fahrenheit. This would make our climate feel like northern New Mexico. Next slide. So Boulder County is starting to think, as I mentioned, about extreme heat and what an emergency might look like. We're thinking on 2 scales. We're thinking about slightly elevated temperatures, and that would be more in the heat advisory realm. So that's where temperatures would be above 100 degrees for several days. And then a heat warning would be more on the scale of the Portland, Seattle, Pacific Northwest heat dome. And that's where temperatures are above 105 degrees for several days. So what you need to know from this slide is that there's several groups who are at risk in these 2 categories of extreme heat emergencies. So in the temperatures 100 degrees Fahrenheit or greater, we're looking at adults over the age of 65. Outdoor workers are a huge area of concern. Households without air conditioning, we talked about how critical that is. Children under the age of 4, individuals with chronic medical conditions, and athletes who are working out outdoors. Now, the critical thing here is when it gets above 105 degrees and we're dealing with a heat warning. This is really a rare event, as we know, but the important thing to remember here is that pretty much everyone is at risk when things get that hot. Let's go to the next slide. So as we mentioned, there are these two categories, a heat advisory and a heat warning, and these are official National Weather Service designations. They're not exactly ideal tools for the Mountain West because we don't have this kind of critical humidity element that the National Weather Service really likes to work off of. Let's head to the next slide. So the other thing that I wanted to mention to you is that, you know, we're talking about these kind of temperatures and the different categories. But the other thing that's really important to remember from this presentation is that if we're in early or late spring and we have our first really, really hot day, or even in the fall, that can cause heat sickness and illness as well in these high risk groups that we've talked about. Okay, let's go to the next slide.
Okay, I'm going to jump in here. Grace, can you hear me? Am I not muted right now? Okay. I'm going to talk a little bit about why folks who are over the age of 65 have higher heat risks. So our body works really hard to keep our core at a stable temperature, at a temperature that's healthy for our body systems to work. And when it comes to heat, our body has two mechanisms that it uses to cool itself down. It uses sweat, and then it can actually shift the way our blood flows in our skin. We sweat evaporates, that cools us off. With blood flow, our bodies can increase skin blood flow out to our extremities. So it kind of moves more of our blood out to our arms and our fingers and our toes. And that pulls heat sort of like a little highway away from the core of our bodies and out to our extremities. As we age, those systems can become less effective. Our bodies don't sweat as much. Our blood flow does not respond as quickly or as efficiently as it needs to cool us down all the way. So what this means is, while hydration is absolutely important for absolutely everyone to maintain in a heat emergency, especially if you do not have air conditioning, for some folks over the age of 65, even if you are fully hydrated, you're still at risk because of the changes in your body that make it harder to monitor your heat or to reduce your heat. So say you are in a situation where you are starting to become ill. We really want you to know what to look out for and when to get help. So there's two main conditions we want you to keep an eye out for. One is heat exhaustion. That you can wind up feeling dizzy or faint. You can start sweating a lot. Your pulse can rise. You can also feel nauseous or have muscle cramping. And that's like a knee there, because I had access to the knee graphic, but a lot of people report cramping in their arms rather than their knees. It's really important, if you are feeling any of these symptoms, that you get to an air-conditioned facility. Go somewhere with air conditioning. Don't just turn on a fan. That's not going to work. We'll talk a little bit more about that later. Also, make sure you are drinking water. Drink before you feel thirsty. Stay fully hydrated. Cool showers and cool compresses can work if you do not have access to an air-conditioned facility. They can help. Heat stroke. Okay, don't get to this point. Don't let your friends get to this point. We don't want anybody to get this sick. Get help when you are in heat exhaustion stage before you get here. This is a very serious condition. And if you don't get help immediately for somebody who has heat stroke, they could pass away. So the signs of heat stroke are people can get start to get sort of confusion and headache. They get really disoriented, almost like after someone has a concussion, where they suddenly stop kind of being really aware of what's going on. And also maybe they're still sweating a lot, but maybe they've stopped sweating. So that's bad. Your body's run out of sweat. You might be cold or clammy, or your skin might be red to the touch. You can even run a fever. Nausea is common, and some people pass out. So if you see any of these, you need to call 911. That is the first thing you should do. And then if you are able, or if you can get help to do so, move the person to the shade. If you can, get them inside air conditioning. Cool cloths, cool bath. It's a little bit controversial, but some people discourage you from giving the person water, mainly because if they're really disoriented and they pass out, they could choke. So don't try to give them water if they're not conscious. That's a bad idea. How do we keep cool? So extreme heat is just, like Grace was saying at the beginning, is this one of those things where, like, it seems so simple, but because it seems so simple, we don't pay attention. And the solutions are also deceptively simple. You go somewhere air conditioned. That is the quote unquote simple answer. During an extreme heat advisory, it's really important that vulnerable groups stay inside air conditioned environments as much as possible. And that's generally between like 2 to 5 p.m. I'm seeing something in the chat here. Cool water or warm water. You know what? Drink what I'll talk about that in the next slide. Okay, so also key here, if you have air conditioning in your home, make sure it's working in the spring before it gets hot, because the day that you have the heat advisory is the day that everybody is calling the air conditioner maintenance person to repair their broken air conditioner. You don't want to be caught with that. So make sure your air conditioner is working, and go somewhere that's air conditioned if you don't have air conditioning in your home. Drinking liquids. So I didn't touch on that point specifically, that was raised in the chat. Drink whatever sounds good to you, but avoid caffeine, sugar, and alcohol. It actually doesn't matter that much if it's warm or cool. I've actually looked this up before. You just need to drink water. Drink before you get thirsty. Keep water handy at all times. If you like to drink lukewarm water, I do, drink that. If you like ice water, drink that. So lots and lots of liquids. If you cannot get to air conditioning, it's a really good strategy to draw your blinds, avoid using your oven, take cool showers and baths, and wear lightweight clothing. These are good strategies anyways, so that you're not fighting your air conditioner, even if you have air conditioning. But if you don't have them, this is really essential to keeping your home as cool as possible. Here we go. If you have to go outside in extreme heat, I mean, we have to go to the grocery store. We might have to walk our dog. Drink lots of water, lots of it. Try to take a good glass of water every 15 minutes if you're in really hot weather outside. Try to go out in the mornings and the evenings. Limit your time outside. If you have to do something outside, you've got to pull the weeds in that garden. Go out in the morning and pace yourself. Try not to do too much at once. Leave some of the weeds till tomorrow. Wear 30 SPF at least sunscreen. Make sure you don't get a sunburn in the process of all this extreme heat stuff. Also, it's really, really important that people understand you should not leave children, adults, or mobility challenged adults children, animals, or mobility challenged adults in a car, even with the windows open. It gets very hot very quickly. Don't do that. Some points of note: fans don't prevent heat illness. They can't cool our core body temperatures. And that's because the only way fans are going to cool you down is through your sweat. So if your body isn't sweating enough, the fan isn't going to help you. That's a misunderstanding for a lot of folks, because it feels really good, but it is really dangerous if you're in a situation where you're at risk. Also, really important to check on your neighbor. A lot of people don't understand that extreme heat is dangerous for them. And it's really important to develop those relationships, and maybe just invite your neighbor over for coffee in the afternoon. Maybe don't even tell them you're checking on them. Just try to do what you can to be a good neighbor and make sure people are safe. Go ahead, Grace.
Great. So as we mentioned, Boulder County has an emergency response plan that we're putting into effect this summer for heat emergencies. And just as a reminder, we're sort of keying off of these two National Weather Service, I guess I'll call them products, but really it's the heat advisory and the heat warning. So a heat advisory would be 100 degrees or more for a couple of days with potential limited cooling at night. A warning is much more serious, that 105 degrees where everyone's at risk. So when that happens, if we get an advisory or a warning, we're going to be urging individuals with no air conditioning to go to Boulder County heat relief sites. And to start out this summer, that's going to be your local library. We're urging individuals to go during the hottest hours of the day. So that's typically 2 to 5, kind of that mid to late afternoon. And a library is a place that you can go to sit and cool off. You can get a drink of water. You can charge up your devices, your iPad, your cell phone, those kinds of things. We'll head to the next slide. Okay, so the other thing that we really want you to remember is if we have a heat advisory or a heat warning, you don't have to go to the library. We just want you to be in air conditioning. So that could be a movie, you could go to a matinee, you could go to a mall that's indoors. And as Stephanie mentioned, you could go to a friend's house and hang out there and put in a movie. The key thing is just to get yourself into air conditioning. Head to the next one. Okay, so so we just put together some frequently asked questions. How do I get to my heat relief site? So this is something Boulder County is working on now. We have existing contracts with a company called Via Mobility. So that is most likely the resource that you would potentially use, but public transit also works. The key thing is we just want you to get to your heat relief site or get into that air conditioning. The other thing is, how can I get help during emergencies? So again, I think that's where talking to your neighbors is so key. And also, you know, the thing to keep in mind is these are relationships that are built over time. So, you know, start building those now so that you can lean on them during an emergency. We'll head to the next slide. Okay, so the other thing we put in here is a question about companion animals. And we wanted to be upfront and say that right now, since this is our sort of first iteration of our heat emergency plan, you right now cannot take your pets to public spaces such as the library, which is what we're leaning on in terms of heat relief sites. But this is something we're really working on, and we want you to know that, and hoping to make some improvements for next summer. And I'm going to put the link in the chat here of just how to keep your animals cool and safe. There's some really good stuff in there just about checking temperatures of concrete and asphalt for your animals' paws, just to make sure that they don't get burnt by that, because if things get really hot, you do have to be careful about that. And then the other thing is to think about talking to friends and neighbors about potentially dropping off your companion animal in a heat emergency. And this is just in general, I think, a really good thing to think about. You know, when you think about the Marshall Fire and how those folks had to evacuate at really a moment's notice, it's a great idea to talk to your neighbors, maybe someone else who has a dog or a cat, some of your friends who live nearby, about, hey, if there's some kind of emergency or a fire or anything, can you, and I'm not at home, can you help can you help evacuate my companion animal? So again, Boulder County is working on finding solutions to this issue going forward, but we did want to talk about our furry friends because they're so important to us. Head to the next one. All right, so what's next? Boulder County now has an extreme heat plan. This is for emergencies, but obviously there's a lot of other things that we need to be thinking about. So this summer, one of the things that we are going to be working on is mapping where the heat hotspots are across the county. So this is typically connected to where there's a lot of asphalt and where there isn't a lot of shade. And we're hoping to overlay the heat hotspots with data on air conditioning in homes and also data associated with area median income. So that's one thing that we're looking at. The other thing, kind of longer term, is once we know where those hot spots are and we have all of our data, we're going to be looking at heat island mitigation. So this is establishing drought resistant trees, more shade in some of the areas that need it. And, you know, also longer term, I wanted to mention heat adaptation strategies. So that would be thinking and pursuing grants that get air conditioners in homes that really need them. So I mentioned we were looking at access to air conditioning, we're looking at where the heat hotspots are, and we're looking at area median income. So it's using all those different layers to really think through and get air conditioning to the homes that need them. Because as we mentioned, that is the #1 strategy to staying safe in a heat emergency. Go ahead, and that's it. So thank you so much. One of the things I wanted to put in the chat, and we're happy to answer any questions, but we do have kind of the first product in a heat communications toolkit that we've put together. So this is just a simple web page that we have. And we're, of course, all of our products will be translated into Spanish. But just wanted to see if anyone has questions at this point.
I'll stop sharing for now so that we're all bigger boxes.
That's good.
Folks can feel free to unmute and ask their questions if they'd like. Or pop it in the chat.
I'm just so happy that everyone loved everything we had to say, and we were so thorough that we didn't spark any questions from you all. So I'm going to take it as a badge. I'm going to be wearing this badge all day. Thank you.
So I'm going to ask a question. It seems like this is really tied to the fact that we're having a climate emergency, and we're talking about multiple factors. We're talking about heat, like I mentioned earlier. We're talking about ozone. We're talking about smoke. I know you can't address all those things in this presentation, but it seems like we need to have a bigger conversation than just get yourself an air conditioner. And so is Boulder County working on that with the appropriate officials?
100%. So one of the things that we're working on many different levels. So it's important for you to know that climate change is a strategic priority for the county and for public health. So I was hired 6 months ago because Boulder County Public Health believes in planning and thinking about climate change at all levels. So today we talked to you about, as you mentioned, sort of the emergency, the most immediate level. But then we also want to think about mitigation. So that's really reducing greenhouse gases as much as we possibly can. But then there's also adaptation. Let's be honest, as long as we're pumping fossil fuels into the atmosphere, we're going to have the greenhouse effect. So we have to be thinking at all those different levels, and we are. The thing I'll also mention to you is that at the city level, they are also thinking very deeply about these types of things. They launched their own version of heat island mapping, and they're doing that. And they've started, I think on the fall, they're going to be having a ballot measure associated with greening and reducing kind of that mitigation aspect. But that's something to watch for, because I think we're really going to be having some critical conversations. And I will say at the state level, I mean, I think the state legislature wraps up today. And at the state level, I mean, even considering like the gridlock that we have, there were some interesting bills that passed. One of the things I was very heartened by was an update to the state level energy codes. And of course, we're a home rule state, but it does set a ground floor for energy efficiency in buildings, because I feel like buildings is this kind of yet another area that we can be thinking of, and also really see some great reductions. We're talking about that mitigation and really trying to reduce greenhouse gases. When you have, you know, gas powered kind of, you know, natural gas homes, you have leaking from natural, you know, some of that natural gas, and all of that can be really mitigated, I think, by some of these code improvements that are that passed both houses and are now going to the governor for signature.
Well, that's good. And I also heard you say you're focusing on equity issues and inclusion. And it sounds like the most vulnerable people are those that are in, like you said, living in mobile homes or lower socioeconomic. So I encourage you to keep helping those people.
Yeah, thank you so much for mentioning that, Kathy, because that's a huge focus at the county and I know for the city. But, you know, I think even if you look at our outreach strategy for this extreme heat plan, equity is key. Translating all of our materials into different languages, reaching out, you know, I think we mentioned in our presentation, 20% of deaths occurred during the Portland heat dome for individuals who are living out of their homes or mobile homes. And so we're going to be giving a version of this presentation to individuals who live in manufactured homes later this summer, because that's another priority population for us here at the county.
Good, thank you.
Thank you. Good question.
I'll just like tag onto that a little bit, Kathy. And I think one of the things you talked about in your question was the intersection of air quality and extreme heat. You know, there are days where we have wildfire smoke and we have extreme heat. So you don't want to tell people. So, I mean, in an extreme heat situation, you don't want people to close their windows. Their home would get too hot during parts of the day. But if there's wildfire smoke and they have a heart condition, it's not great for them to be exposed to the wildfire smoke coming into their homes. This is a problem which requires folks in those situations to go outside of their home to get relief. They have to go to a heat relief site because there's no good answer in their home. And that's why we're working really hard to make sure that there's transportation and to get answers soon about how companion animals are addressed, because we just want to make sure that people in a situation like that without air conditioning and during a wildfire event and an extreme heat event at the same time feel like they have access to ways to be safe. Corin asked a question about if you don't have central air, what's a good substitute? Corin, okay, the bad news is there's not really a substitute if you are an at-risk person. And I wish I could give you a better answer than that. In terms of a swamp coolers are not a substitute for central air when it comes to vulnerable people on an extreme heat day. It can definitely help you be more comfortable on a day that's not an extreme heat day, and it can definitely help you be more comfortable if you're not at high risk. But if you are at high risk, I would urge you to make a plan for how to be in an air-conditioned environment on that day. Now, in terms of a portable window air conditioning unit, you know, if you just kind of stay in your bedroom where it's nice and cool, I think that would help. So if you have a window air conditioning unit and you can just sort of camp out in your bedroom for that day, that could work. I think I don't think I've seen the data on that specific question, but I think that's probably much more likely to work than a swamp cooler. And also, I think I just want to address here that it's not really fair to tell people that they have to get expensive air conditioning to be safe in their homes on a high heat day. It's not okay. Folks should be safe in their homes, and we shouldn't have to deal with more extreme heat days. But we are going to, so we have to do what we can to prepare. And I think that addresses the portable AC unit question pretty good. But if there's more questions about that, Grace and I are happy to answer.
I think Carol might be pointing to those ones that you plug into the wall that kind of shift around. That's comparable to a window unit?
I haven't looked at those. The one I have is a swamp cooler, actually. The one I used to have that went around the house was a swamp cooler. And
I know what Carol's referring to. It's similar. I think the key thing is to, if you can put it in a bedroom and shut the door and spend, really to contain it and get that temperature down, that's the key thing. So that's a good question, Carol.
Well, and I appreciate that your focus has been on, it's not just try to cool down where you're at, but get to somewhere that's already cool, because I think that's really important, at least from an agency perspective on our side. We've been looking at, do we need to buy a bunch of portable AC units in order to get, to folks? And so I appreciate sort of the messaging around that for us professionally to think about what is the best resources to provide people in these sorts of instances. So.
Well, and a lot of you folks know better than Grace and I about your specific clients and their needs. You know what their mobility challenges might be, or their mobility abilities might be. And so, for this person, transporting this person out of their home may really not be feasible. And in that case, there might be a need to look into some sort of grant program to try to work. And in some areas, like in the Northwest, Grace and I interviewed some of the public health folks from the Northwest. They are working on a grant program to use heat pump technology as a more sustainable way to provide air conditioning in vulnerable homes, so that they're not having as much of an impact on increasing greenhouse gases by using air conditioning. And obviously that's a problem too.
Sadly, though, it ain't cheap. Let's be honest.
It's not.
Heat pumps are expensive.
Yeah. That's something they're working on. That is not on our radar, to be very clear. We do not have those resources right now.
Yeah, and heat pumps are expensive and they're just not as efficient on the heating side. Or maybe not efficient is the word, not as effective on the heating side of things. So interested in that. It looks like Corinne had another question in the chat as well around serving.
Oh, so mountain areas. Okay, so here's one thing. We do expect it'll be quite some time before these extreme heat impacts are fully affecting mountain areas. We do expect that there will be a lag of a few years before things get more intense in those areas. And I think transportation in that area might be something that's looked at in the future. Grace, you'll have to answer that question.
Yeah, absolutely. I think this summer, we have our first plan in place, and at the end of the summer, we'll be really just reviewing if we had, I think it's more likely that we'll have a heat advisory than a heat warning, but just really reviewing what worked and what didn't. And then, as I mentioned, we see this as an iterative process. It took several years to even get to the point where we have an extreme heat emergency plan. And I think this is something that we'll just be iterating over time. It's really not going away, sadly.
I remember in the past, the fire department would come around and open up the hydrants and, flood the street and let the kids play in the water. And is that like old school, and that's not something people do anymore?
That's a good question. I know that that water is very valuable out here in the West, so that might be why you don't see that here. But who knows? And I mean, I was looking at the temperatures, Kathy, for like the Portland heat dome. I mean, that was, I think it was 114 degrees. So when it gets that hot, maybe there'll be more flexibility. We'll see.
And it's certainly true that young kids are vulnerable. It's the kids under 4 that their bodies can't cool off as quickly, similar to folks who are older adults. A 3-year-old in a fire hydrant might be a little risky. And for folks who are older adults, I don't really see my mom in her 70s doing well playing in the fire hydrant. That's probably not going to be a good plan for her. She would probably fall. So
Point taken on both those.
All right, so an extreme heat emergency, we'll see if we can open a fire hydrant, just play for fun. I'll bring the popsicles. It'll be good.
with popcorn.
No, okay, no, it's okay. All right, I don't see any other questions. Anybody else have anything else for Grace and Stephanie before we close out? This was a great presentation. Thank you, Grace and Stephanie, for bringing this up. We'll get the word out through the recording as well, and hopefully get this on more folks' radar going forward. And thank you for bringing this to us and putting together this presentation. So appreciate it.
Thank you.
Right, thanks everyone.